Laura Crocetti. I'm an associate professor of radiology at University of Pisa, and I am an interventional radiologist working at the Division of Interventional Radiology at Pisa Hospital. We are at Cisanello Hospital, one of the facilities of Pisa hospitals, and we are actually a referral center for many disciplines that brings to us many patients, not only from Pisa surroundings, but also from all the region, Tuscany, and from all the parts of Italy. My clinical and research focus is on interventional oncology, the fourth pillar of cancer care, together with surgical oncology, medical oncology, and radiation oncology. The main goal of interventional oncology is to perform minimally invasive treatments with imaging guidance. For doing this, it is very important that the interventional oncologists take part into the multidisciplinary tumor boards meeting. In fact, in our hospital, we have many of them focusing on liver cancer, colon cancer and metastatic colon cancer, breast cancer, lung, and many others, including rare tumors. We acquired the IMACTIS CT navigation system in 2021 as an electromagnetic navigation system for CT-guided percutaneous interventions. We immediately realized that we had done a good deal buying this system because this brought to our patients many benefits. First of all, IMACTIS CT navigation for us is very easy to use. The workflow is very fast. The CT images are acquired on the CT scan, then the time to push these images to the system is really very fast, and really in few seconds you will be able to see the images and to navigate them into a perpendicular plane in real time at the bed of your patient. Our experience with the IMACTIS CT navigation was that the learning curve was very fast. We work in team with well-trained radiographers, of course, and for both of us it was a very fast process to learn how to use IMACTIS navigation system. Moreover, IMACTIS CT navigation system is not very bulky. It is very easy to be transferred. We have very small suites actually, so for us it is very important not to have a bulky material to use. The work of interventional oncologists is really very tied to imaging guidance. And a problem that we often experience with the conventional CT as a guidance is the use of out-of-plane trajectories and the fact that you have fixed images and you have to go back and forth from the room if you do not have, of course, a fluoro CT or other nice, fancy model CTs. By using IMACTIS CT navigation system, we were able to overcome these limitations. So we are able to navigate the images into planes and to find new and unexpected trajectories, out-of-plane trajectories, to reach difficult targets in difficult positions near to organs or structures we do not want to damage with our needles or antennas. The patients that benefit most from the use of CT navigation system in our experience are those with lesions that are difficult to reach, for example, very deeply seated, or in organs when you have some other structure on the way, especially if those structures and organs are those that are not moving a lot with breathing. For example, we use it very seldom in kidney and bone procedures. If you want to use it in liver and lung procedures, of course you can, and it is extremely useful in our experience, but you have to work very well in cooperation with your anesthesiologist in order to synchronize the acquisition of the CT scan and then the puncture in the same phase of breathing. Another clinical situation where we think that the IMACTIS CT navigation system is particularly useful is when we use a multi-probe, multi-antenna approach to our tumors to treat. For example, when we perform cryo of kidney, that usually it is a multi-probe procedure, it is very useful in our experience to have the help of this navigation system to place the probes in lower time, reducing therefore the procedural time. In particular, when we are performing ablation procedures with either cryo or microwave, the devices have a very heavy handle, and it is very important in those cases to have the possibility to insert the needle for a very long way at the first attempt. Otherwise, doing many attempts will make the procedures more difficult with the needle or the antenna bending down, and therefore having a precise tool for imaging guidance like IMACTIS CT navigation system, in our experience, is very useful. The use of IMACTIS CT navigation system reduces the number of CT controls. Therefore, this may allow us to optimize the dose for the patient. And now that we are, I can say, quite experienced in using IMACTIS CT navigation system in combination with CT, we are ready to move in the angiography suite and to use it in combination with Conbeam CT.